What's up, TUMNAD lectures? In this video, we are going to be looking on what we call venous return. If you find this video helpful at the end of the video, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now when we talk about venous return, we need to first understand what is venous return. Simply means blood flow back to the heart. It's all that simple, okay? Blood flow back to the heart. So now we have said that venous return means blood flow. It means blood flow back. Blood flow back to the heart. Okay? So now that is a simplified definition of what we call venous return. There are a lot of factors which are going to be promoting this kind of venous return. Let's go ahead and get started and look at those factors which promote venous return. So let's go ahead and get started and look at what we call the factors which promote venous return. The first one is what we call respiratory pump. What do I mean when we talk of respiratory pump? Whenever you're breathing in during inspiration, you're going to be having what we call contraction of the diaphragm. Now, the diaphragm is going to be contracting and it moves down. Once it moves down, it is going to be increasing what we call the thoracic volume. And by Boy's law, whenever you increase what we call thoracic volume, you're going to be decreasing what we call the thoracic pressure. Okay, meaning that you're going to be having a decrease in what we call the thoracic pressures, and there's going to be an increase in what we call intra-abdominal pressures. Now, all those kind of the veins are going to be squeezed because of the kind of high magma pressures to move the blood up to the thoracic region, because now it's going to be having low pressures. And because we have the heart in the thoracic cavity, it is going to become more easy for the blood to come back into what we call the thoracic region and back then into what we call to the heart. Okay, so now that is how inspiration can promote what we call a venous return, which we are calling respiratory pump. Okay, so now the first point is going to be what we call respiratory pump. Okay, that is the first function which that is the first factor which promotes venous return. And the second one is what we call muscular milking. What do I mean when I talk of muscular milking? You know, these veins, they are always deep buried in what we call different kind of the muscles, especially what we call the skeletal muscle. Now, whenever the skeletal muscles contract, they will be squeezing on this kind of the blood vessels. They will be milking, they will be exerting that kind of the pressure to move the blood up and up and up, and then finally into what we call to the heart. By doing that, muscular milking or skeletal muscle pump also promote what we call venous return. Okay, so now this point here is what we call muscular milking. Okay, what we call muscular milking. Some people may call it skeletal muscle pump. Okay, so now that's going to be the second point which promote a venous return. Another kind of the factor which promote venous return is the presence of these structures here within what we call the veins. These structures, they ensure unidirectional in blood flow. By ensuring unidirectional in blood flow, you are promoting blood coming back to the heart. Because if you're not ensuring uniformity or unidirectional in blood flow, blood will be tending to flow back. And that one will be affecting what we call blood coming back to the heart. So now these structures also promote what we call venous return. These structures here are what we call venous valves. Okay, these structures here are what we call venous valves. Okay, so now venous valves are also playing a very, very, very big role in promoting what we call venous return. Another kind of the factor is that, this is going to be a bottle of what we call normal saline. Whenever you infuse fluids on what we call the body, you're going to be trying to increase what we call blood volume. And if you increase the blood volume, it means the blood which is going to go back to the heart will have increased. And by doing that, you will be increasing what we call venous return. So adequate blood volume also promote what we call venous return. Okay, so now this one here is going to be what we call adequate blood volume. Okay, adequate blood volume is also super very important factor which promote a venous return. If you lose a lot of the blood, for example, during diarrhea or during maybe any kind of bleeding, it means you're going to be reducing on the blood volume. So now if you reduce on the blood volume because of that kind of the loss during bleeding, during vomiting, that one is going to be reducing on the blood volume. Do you expect to have much return? You will not have much return. So all those ones are also going to be affecting what we call the venous return. So adequate blood volume also promote what we call venous return. Okay. Then we also have this structure here. You see this man the way he's sleeping is raising the lower limbs slightly above what we call the body trunk. There is a reason for this. This one in most cases we always advise whenever patient is having edema, lower limb edema. We always tell them that we elevate their kind of the legs slightly a bit upper than the body trunk. The significance of this, these body fluids in the areas which is swollen will now start moving back by gravity, and then it will finally find itself with what we call to the heart. Okay, by doing this, by elevating the limb slightly a bit upper, is trying to increase what we call blood flow back into what we call to the heart. And by doing that, the edema slowly but slowly is going to be subsiding. So now this kind of the factor is what we call gravity. Okay, is what we call gravity. Okay, that factor is what we call gravity. It can also promote what we call venous return. Okay, and then another kind of the factor which can promote venous return is what we call sympathetic effect on what we call the venous, which some people call sympathetic vasoconstriction. Now, if there is a release of this sympathetic neuron, they release what we call norepinephrine. This one is going to be causing vasoconstriction to act on the small muscles of the veins, and they cause them to constrict. By constricting, they are going to be narrowing the diameter of the veins, which will increase the pressures, which will increase the blood flow back into the heart. Okay, so now this kind of the factor here is what we call sympathetic vasoconstriction, or it can also be called venomotor. Okay, so now this one can be called veno, what we call venomotor, or some people can call it what we call sympathetic vasoconstriction. Okay, it is such another beautiful thing. So now there is another kind of the factor which promotes venous return. You know, whenever the heart contracts, there is a way it creates a slight kind of a negative pressure, especially in what we call the right atrium. Now, that kind of the contraction is going to be creating that kind of slight kind of negative kind of the pressure in the right atria, which will suck the blood back into what we call the right atrium. And that kind of the factor is what we call the cardiac suction effect. Is what we call the cardiac suction. Okay, cardiac suction. Okay, some people may call it cardiac suction effect. It is also such another beautiful. Now that we have seen on the factors which promote venous return, let's go ahead and finalize with the factors affecting what we call cardiac output. Okay, so let's briefly look at what we call the factors that affect cardiac output. All along, we have been talking about cardiac output, the components, the calculations, the heart rate, the stroke volume. Let's go now and look at what we call the factors that affect cardiac output. And of course, cardiac output is going to be the volume of the blood ejected off of the heart every single minute that passes. However, some authors have gone ahead and to define it that cardiac output is the volume of the blood ejected by the left ventricle into the systemic circulation. Some others have defined it in that way. It also makes a lot of sense that cardiac output, we're going to be mainly focusing on what we call the left ventricle. Okay? It is such another beautiful thing. So now, what are those factors that really affect what we call cardiac output? The first one, which is super very important, is what we call heart rate. Okay, so now heart rate, because we said that cardiac output is going to be a product of stroke volume and heart rate. If anything interferes with what we call heart rate, it will be automatically increasing or decreasing what we call the cardiac output. Okay, so now heart rate is one of the factors which affect cardiac output. Now the second one is what we call all the determinants of what we call stroke volume. All determinants of the stroke volume will affect what we call cardiac output. So now, what are those kind of the determinants of what we call stroke volume? The first one is what we call preload. Okay, what we call preload. So now preload, we said that this is the degree of myocardial stretch. So now if you have a lot of the venous return, it means that also the degree of myocardial stretch will become extensively too much. And of course, this one is going to be determining how much is going to be leaving what we call the ventricles. Okay. And then the third kind of the factor is what we call the contractility. Okay, what we call the contractility, and we looked at the different factors which affect contractility. So now, if there is a strong contraction, you expect a lot of the ejection of the blood off into from the ventricles. Okay, so now contractility can also affect what we call cardiac output. Another one is what we call afterload. Okay, is what we call afterload. So now afterload, we said that is the resistance the heart must first overcome to eject blood of the ventricle. So now this one also will determine how much of the blood is going to be leaving of the ventricles. And if there is too much of the afterload, it's going to be less of the blood going to be ejected of the ventricles. So now this one also is going to be affecting what we call cardiac output. And then another one is going to be what we call venous return. And of course, we have just said that venous return is the blood flowing back to the heart. So now, if there is less blood coming back to the heart, you'll also automatically expect less blood leaving the ventricles. Okay, and by doing that, we are also regulating on what we call cardiac output. So now, venous return also affects cardiac output. Another one is what we call blood volume. Okay, another one is what we call blood volume. And when we talk about blood volume, if you have a lot of the blood volume, and then you'll be expecting to have an increased venous return. And if you have an increased venous return, you'll automatically have an extensive amount of the blood which is going to be leaving the ventricles. So now, cardiac output can also be affected by what we call the volume of the blood a person is going to be having. Okay, and then we also have what we call physiological factors which affect what we call cardiac output. So we also have what we call physiological factors. Physiological factors. Okay, we also have what we call physiological factors. And some of the examples of physiological factors which can affect cardiac output, the first one is going to be what we call sex. And of course, we have to know that females are going to be having a slightly kind of the heart rate compared to what we call males. So now, if they have high heart rate compared to males, it means even also their cardiac output is also going to be slightly higher compared to what we call the males. Okay, so now sex is also one of the physiological factors affecting cardiac output. Another one is what we call pregnancy. Pregnancy. So now also pregnancy can also affect what we call cardiac output because pregnant mothers they tend to have an elevated kind of the heart rate, and of course if you have an increased heart rate, you're going to be having an increase in what we call the cardiac output. Okay. Another one is going to be what we call the posture. The position that you're going to be in can also affect what we call the cardiac output. And then maybe another one is going to be what we call exercise. Okay, what we call exercise. So the more you do vigorous exercise, the more you're going to be increasing what we call the heart rate, and the more you increase what we call the cardiac output. Okay, so now those are the physiological factors affecting cardiac output. But we also have what we call pathological factors. Okay, we also have what we call pathological factors. And when I talk of pathological factors, the classic example among the pathological factors is going to be what we call fever. Whenever you have an extensive amount of the fevers, this one is going to be increasing on what we call the heart rate. And if you increase the heart rate, you're going to be increasing what we call cardiac output. So fever among the pathological factors can also affect what we call cardiac output. And then another one is going to be what we call hyperthyroidism. Okay, what we call hyperthyroidism. So now hyperthyroidism following an increment in what we call the thyroid hormones, this one also can affect what we call cardiac output because we said that thyroid hormones they are going to be entering what we call the heart muscles. They stimulate the genes which increase on expression of beta 1 adrenergic receptors, and of which if you have a lot of beta 1 adrenergic receptors being expressed, and you have a lot of what we call norepinephrine and epinephrine, you're going to be increasing contractility of the heart muscles. And if you increase the contractility of heart muscles, automatically you're going to be increasing on what we call the ejection fraction, of which will be affecting what we call the cardiac output. So now that briefly covers the factors which affect what we call cardiac output, heart rate, full load, contractility, afterload, venous return, and blood volume. Then physiologically, sex, pregnancy, posture, and then exercise. Pathologically, fever, and even what we call hyperthyroidism. Okay, so now that briefly covers what we call venous return, factors that promote venous return, and factors affecting what we call cardiac output. Thank you very much for watching, and if you think whatever I have talked is making sense, is adding to you, you're benefiting, please, you can support me, and that one can be done by a couple of means. You hit the like button, comment down in the comment section, and please subscribe. As always, to TUMNAD, until we meet next time.